Hello, I'm Dr. Karola Belton and I'm a perinatal clinical psychologist. As a perinatal psychologist, I support women, men and couples across all stages of creating their families. I see people who are struggling with infertility and IVF treatment. I support people who are experiencing anxiety and depression in pregnancy and in the postnatal period. I help people through the significant grief of pregnancy loss and stillbirth. And I help new parents navigate their new lives as parents. I'm here to talk about navigating life as a new parent, and in thinking about what to present, I've pulled together the main themes that people come to talk to me about as new parents. And these are things that all parents, to one degree or another, are going to experience as they're starting out their new life as parents. First and foremost, parenting is about very big feelings, and these feelings can be conflicting and they can be very confusing. Your heart can be exploding with love for your baby one minute, and you can be really lamenting the loss of your pre-baby life the next. You might feel very tied to your baby and exhausted by the demands of her, but the idea of leaving her and going out for a walk on your own might fill you with panic. So it can feel very overwhelming. So what can you do with the overwhelming feelings? Well, first and foremost, it's so important to acknowledge what you're feeling. Try and understand what it's about. Try and help your feelings guide what you need. Are you needing a break? Are you needing more support? Are you needing a bit of time out? Our feelings can be very good guides to helping us understand what we need. When feelings become very overwhelming, it's also really important to try and centre yourself in the here and now so that your feelings don't take you away. Try and bring yourself back to now. The second area of navigating life as a new parent that is often quite overwhelming are the new roles and identities that come with it. You might miss your before baby you might miss your work, you might miss your friendship connections. There is so much that is new about parenting, and it takes time to get used to the new role. It gets time to get used to the new you. Some things to think about when getting used to your new roles as parents is it takes time to feel familiar in the new role. It takes time to feel confident. It takes time to understand what your baby needs and what you need as a parent. It's okay not to love all aspects of parenting. There is a myth particularly about mothers, that you should love everything that you do, you should be content in your role, and that it should be easy. This myth isn't really helpful because it doesn't tell the whole story. There is so much about parenting that is wonderful and joyful, but there is so much that's also really hard. And so giving yourself space to feel all of those feelings is so very important as you learn your new role. Your new role may reveal aspects of your personality you didn't know about or hadn't felt for some time. For example, it might help you realise that your relationship with chaos and uncertainty needs a little bit of work. Give yourself time to develop those skills. Learn to accept that there's a lot you don't know yet, but also celebrate your increasing skills. Day by day, you are learning much more than you did know, so make sure you give yourself credit for that as well. The third area is relationship changes. Becoming parents is very strengthening for relationships, but it can also create a great deal of tension. When you think about all the changes that you go through as a couple when you become parents, there are so many that can be impactful. There's less time spent together, there may be financial difficulties, the new roles that you're learning, less time together. All of this can really impact relationships. So some things to think about as you're finding your way through. Try and make time together. Now, certainly in the first 6 weeks or so, you won't have time to do this, but if you can try and find little ways of connecting with each other. It might be a walk around the block. It might be having a date dinner at home, but trying to prioritise a little bit of time with each other without your baby, where you can talk about non-baby things. That can be very connecting and can help both of you remember what it's like to be together. Couples also typically differ in the pace of their skill development and their confidence in parenting. So it's really important to give each other the time to learn how to do things. Stay-at-home mums often develop skills quicker than dads. Give each other time to learn to do it your way. Try and resist the urge to jump in and over-help each other. It's really important that both parents find their feet and learn to do things their way. And remember, there's often many ways of doing something well. Try and reflect on the expectations you're having of each other. Are your expectations helpful? Are they realistic? Also, try and notice when competition starts to creep in. Now, this is a very common one with parents. The competition for who is more tired, the competition for who is doing more. If you notice that competition has started to creep into your relationship, take time to talk about it. If there are imbalances in who's doing what, try and work out better ways of doing it. Remember that you are both trying the best you can, and while that may not always look the way you want it to look, try and remember goodwill goes a long way. Try and ensure that part of the conversations you have with each other also include, how are we going to take care of ourselves? How is each of us going to make the time to look after our own well-being? How are we going to take the time out that we need to keep some balance and to make sure that we're getting enough rest? The last thing I'd like to talk about is the stress, anxiety and depression that can sometimes be part of pregnancy and new parenting. When you think about all of the changes that happen in pregnancy and birth and new parenting, it's not hard to understand that a woman is at greater risk in this time of developing mental health issues than at any other time in life. When anxiety and depression occur in the first year after a baby is born, we refer to them as postnatal anxiety and postnatal depression. Up to 1 in 6 new mothers and up to 1 in 10 new fathers will experience depression in that first year after the birth of their baby. And postnatal anxiety is just as common. This is different from the baby blues. Around 80% of new mums will experience teariness and flat mood in the first couple of weeks after their baby is born, and this is due to the sudden drop in pregnancy hormones. Baby blues will normally dissipate on their own without any real intervention apart from understanding and support. So what does anxiety and depression look like? Well, the symptoms can be varied depending on the person. It may present as sadness and teariness. It might present as having lots of worries, quite often focused on the health and well-being of your baby. It can present as irritability and anger. It can present as teariness. It can present as withdrawal. It might present as not wanting to be around your baby, or conversely, not wanting to be apart from your baby. It might be withdrawal from family or friends. Is it depression, anxiety, or simply the exhaustion of being a new parent? It can be very tricky to work out just what is going on. After all, so many of the things that we experience as new parents are also some of the signs and symptoms of anxiety and depression. But if your feelings are big, if they are impacting the way you can look after yourself or look after your baby, and if they last for more than 2 weeks, it's probably a sign that depression and anxiety are creeping in. So what are the causes of postnatal anxiety and depression? Well, as with all psychological issues, there isn't just one cause. It's a combination of what we call risk factors or pressures and not enough protective factors. Too many psychological pressures plus not enough supports can often result in the stress and anxiety and depression. We think about risk factors as sometimes being longer term issues, like a history of mental illness. It might be personality factors, such as a perfectionist personality or a very driven personality. It might be too many life stresses that are happening at the time of pregnancy or after birth. We also think about current life pressures or pregnancy and baby-related pressures. It might be a traumatic birth. It might be feeding difficulties. It could be having a baby who's colicky or has reflux. It could be simply juggling a newborn with other children. So what can help? When we think about those factors that can help minimise the risk of postnatal anxiety and depression or help reduce the symptoms, we're thinking of things that are reducing the pressure and increasing connections. Social connections are a very important part of helping manage the risk. Social connection is very important as a new parent, and finding ways to connect into friends, with family, trying to make new friends who are parents is a very important part in helping your mental health and well-being as a new parent. It can help very much to talk about how you're feeling, finding those supportive people in your world, whether they're your partner, whether they're your friends, whether they're your parents. Some of the basic psychological first aid factors like exercise, eating well, drinking enough water, all of those can really make a difference to how you feel. It's also really important to be careful of how you're judging yourself. As new parents, it's very easy to measure your self-worth by your baby's progress, by how well your baby's sleeping or feeding, or how your baby's developing. So be very careful about the judgments you're making about you. It's also really helpful to identify your sources of pressure and stress. And once you've identified what they are, try and work out how you can minimise them or how you can manage them differently. As with so much that I'm talking about, it's very important to acknowledge your feelings, give them space to be, and as you're doing that, work out what you need to help you through. Finally, it's so very important to ask for help. If you're concerned about your feelings, if you're concerned about your thoughts, reach out to your GP, find a psychologist who you can talk to. It's also really helpful to try and find ways of taking time out from the demands of parenting. And while this might not come naturally, it's so very important to try and find connections to the pre-baby you, to find friends that you can hang out with, to do some of those activities that before you had a baby helped you feel like you. And if you're finding that you're struggling, remember you're not alone. There are lots of very good supports out there, and you will get through it.